This is Dr. Christine Ebert-Santos, CHRISTINE EBERT-SANTOS.
And tell us where you are and what you do.
I'm in my office at Ebert Family Clinic in Frisco. I've had this clinic for 20 years. I'm a pediatrician, and I have a family practice nurse who sees adults and children working with me.
What is, like, for people who aren't familiar with Frisco, what is it like to live in Frisco?
Frisco in Summit County and Lake County and Park County are the highest elevated populated areas in North America at between 9,000 and 11,000 feet. So we have a unique environment with lots of mountains, a lot of snow, a beautiful lake, and lots of outdoor activities.
Sounds lovely. What can you describe the demographic there?
The population of the county is about 30. We do have about 20% Hispanic population. My clinic is about 50% Hispanic population. Those are the service workers, the majority. And other than that, there are people from all over the world. There's a lot of second homeowners. There's a lot of retirees, and just people who are competitive athletes and love to be active in the outdoors.
Mm-hmm. It sounds like a great training facility for athletes if it's so high in the mountains. And it sounds like you have a wide range of different people and backgrounds there as well.
Yep.
Can you talk about how COVID-19 affected Summit County?
Interestingly, the first identified case in Colorado was in Summit County, and it was a visitor who had been traveling in Italy. He flew into Denver, rented a car, and drove up for a ski vacation in Summit County. Got sick the second day he was here. However, there probably were other cases before that. We just haven't been able to identify them. So that led to a pretty quick shutdown within a week. Governor Polis closed the ski resorts, which is our main source of income up here, all the tourists, and it was our busiest peak season, secondary to Christmas, because it was coming up to Easter break. So it was pretty dramatic to, within 5 days, close down all the hotels, lodging, Airbnb, and get everyone out of here, including a lot of the employees who worked at the ski resorts who come from all over the world.
So they were encouraged to leave.
Yes, if they didn't have permanent housing, if they were employee housing, they tried to get everybody on a plane and out of here that was on like the visas for the short-term workers.
I see.
And other people who were going to be out of work and not have any income.
I see. How did that affect, how has COVID, what are you seeing in your clinic?
Well, we shut down pretty quickly to sick visits. So for that month of mid-March to the end of April, those 6 weeks, we had very few patients. We did see quite a few adult patients by telehealth. And now we are just starting to have increasing numbers of kids coming in for checkups, because we feel it's very important that they get their vaccinations so we don't have another outbreak of measles or pertussis when they start getting together and going to school again.
Can you tell me about how the event highlighted or affected healthcare disparities or the social determinants of health in
I
your
had a
communities?
I had a family who brought their children for their physical exam a couple weeks ago because they said they were going to terminate their health insurance. They couldn't afford it. They had lost both parents had lost their source of income. And so the health insurance was the first thing to go. So they came in to get their checkups before they would no longer be insured. And I think that's a pretty common thing, although in my clinic, I do have a lot of Medicaid and Medicare patients. So that will always be available. And I have heard of some young adults who were able to be reinstated onto Medicaid when they lost their job and their income went down. So that's very important for our community. Other than that, there are people who are still working from home and retaining their insurance. Luckily, I think food insecurity is another problem for families who have lost their income, and there are several food banks and several agencies that are checking on those families. They do have a program that replaces a school lunch where parents can walk over or drive up and get food to go from either the high school or one of the elementary schools. So that's helped there. There's several programs that are helping people with rent who are unable to pay rent. And so hopefully, we're picking up the slack in our community.
Um, do you have any thoughts on specifically about the rural experience with this pandemic?
Well, it's good and it's bad. We have a lot more space. We can get out and walk and ride our bikes and hike. So that way we have a lot of good, positive things for mental health. And but as far as the biggest concern at the beginning of the outbreak was that the rural hospital, our little St. Anthony Summit Medical Center here, could quickly be overrun with very sick patients, and we wouldn't have enough staff or ventilators or rooms. And that was Governor Polis's main reason for shutting down the ski resorts and telling people do not go to the mountains. And so we do have a little bit of experience with this because twice a year we have mud season when all the tourists are gone, and usually it's May and June or October and November, and everything slows down and it's just us locals. The only difference is that most of the time, those of us who live and work here try and prepare for those seasons of decreased income when our short-term rentals or our Airbnb rooms are empty, and or the restaurants and bars are depopulated. There's no tourists, there's only locals. So that's the time when locals often go on vacations or take a month off. The difference is we can't go anywhere.
Mm-hmm.
But that's not so bad when you live here.
Yeah.
So maybe we're in the best situation of anybody. We're not missing out on much.
Yeah. How are people feeling as I think we're now, at least in the first full week of safer at home. How do you think people in Summit County are feeling about that?
Well, I do talk to a lot of people. I've talked to the parents who brought their children in today. I talked to my friends, my family members, and I also try and do a tremendous amount of reading about every new development and all the data coming out. And I don't know, I haven't talked to anybody who is gung-ho of ramping up small businesses, restaurants again. We all feel that, especially in Summit County, because of the delay in obtaining testing, we have so many new positives every day, like 13 new positives today. And in our small population, that looks like a lot. But it could be that it was always like that, but we just weren't able to test until about 10 days ago when testing ramped up. So it's right there in the paper every day. We're facing it, that there are all these new positives every day. So I think we're pretty content to sit tight, pretend it's just our normal mud season, and enjoy where we're at, and not really go crazy trying to meet up with friends and family. And I've been telling everyone I talk to, you shouldn't cross county lines. Eagle County had a very bad outbreak, which now is under control. Denver certainly has a lot more population density and risk. And perhaps, it's possible that we are the greatest risk at all, and we should not be out there exposing anyone that if it's not completely necessary. We had 9 grocery store workers test positive last week, and that was a shock. That made that sent a message to everyone.
Yeah, that's scary.
So everyone's wearing masks.
Everyone's wearing masks.
Yes. Mm-hmm.
I wanted to ask, I mean, like in Montrose or maybe Delta, someone I was talking to about from there was saying that their high numbers were because of outbreaks in nursing homes and one pet treat factory, but I hadn't heard of.
But we have no nursing homes and we have no factories.
So grocery stores, huh?
Yeah. So even though we don't have any barracks or crowded housing areas, it wouldn't be unusual for many of our service workers to be living with maybe 6 or 7 people in a 2-bedroom apartment.
Mm-hmm. And are those permanent? Do you think most of those people are permanent residents?
They are. They're permanent.
Wow.
That's probably been the highest positive area. As you hear nationwide, the Hispanics
Mm-hmm.
have higher number of positive COVID cases, and the families that I have dealt with and talked to that have had COVID-like symptoms have had connections in the Hispanic community.
Why do you think that is? Or do you
because they live so many people in a smaller space, and they have multiple generations, and they may have visitors from other parts of the state or parts of the world. Yeah.
How do you think this will alter how the future of healthcare?
Well, I really hope that we can get our priorities straight and cover everyone. I'm a fan of Medicare for all. I think we should learn from this lesson that depending on funding our healthcare by fee for service is a total disaster, and that all the healthcare systems that have had to deal with the COVID epidemic in other parts of the world are generating and getting the same budget and revenue that they would, if not more, because of all the services they're providing. Whereas our system is just being decimated. I read every day that they're laying off healthcare workers, they're cutting budgets, they're closing down hospitals, because our system, our healthcare payment system, is so broken and even corrupt, you would say, because the people who are in administration and who are doing the business of health insurance are paying their CEOs millions and millions of dollars, whereas the nurses and the healthcare workers and doctors make the same as they've always made. Their salaries don't go up very much, and it's just a disaster, the whole system. So I hope that this is going to move us closer to a more fair healthcare payment system like Medicare for all. I also think that the telehealth is a fabulous thing. I don't really feel I'm getting as good an exam on my patients. I miss that touch, being able to look in their ears and listen to their heart. So it's certainly not the answer to everything, but there are so many conditions that we can treat without having to lay hands on. And in the rural area, particularly where people drive an hour and a half from Buena Vista or partial to come to my clinic. And so if we can reduce the amount of travel that people have to do and still provide adequate health care, that's going to be a great step forward. We've been talking about it for years, and we've tried it. We've dipped our toes in the water, but now we're just had to jump in and swim. And that is really going to move things forward. I think that's real. It's funny that the Children's Hospital specialty clinics took a little bit longer to get on that wagon. It took them a few more weeks, but finally a couple weeks ago, or 3 weeks ago, my patients were getting their telehealth visits with specialists. And that is so great for us, because for my Hispanic service worker families to take a day off and take their child down to a specialty clinic, that when, 50% of the time it could probably be done remotely, we just needed a kick in the butt to get that going. So that's a very good thing. And the other good thing is I think people are getting much more aware of how to stay healthy, how to protect themselves from contagious diseases, and what a difference it can make. Every winter, we see so many cases of RSV, babies just wheezing and suffering and having to use oxygen, and kids with school, as soon as school starts, they're getting strep throats and influenzas just raging. And all of a sudden, since we started this quarantine, nobody's getting those illnesses.
Mm-hmm.
The people who are calling me and say they have, I've had a sore throat for 3 weeks, or I have a headache, or, my baby coughed a couple times yesterday. There is, there's some chance that some of those are mild COVID cases, but a lot of that too is just anxiety and focusing. Like a mother is there with her kids day after day, and one day she notices how big their tonsils are, and starts texting me about her kids' tonsils. And then when we have a telehealth visit, I can see that it's the mom's problem, not the kid's problem. Yeah, your kids are fine, and it's just because you're stuck there at home with them all day long.
You don't have enough to do.
Yes, you're focusing in on things that you don't need to worry about. So that's been interesting too.
This is great. I sure appreciate your time. The things that you're bringing up are all the things I wanted to touch on. Can you talk about where am I?
Do you want to see?
Students.
Okay, our poor students. I have one sitting next to me here. Can you see her?
Hi. How are you?
Oh, she's from Red Rocks.
Yes.
And she's been living in Colorado and quarantined alone for the last 6 weeks. It's been really tough because I love my students. I usually have 2 or 3 students in my office at a time. And I had to send my last 2 students away. I said yes, I let them come. One was coming from Eagle County and the other was coming from Denver. But after the first few days, when I realized that they were going back and forth, they weren't staying in Summit, and one of them was working in the respiratory unit of Children's Hospital, I said, I just don't think that this feels safe for my staff and for my patients. So they left. And most students have not been able to be on active rotations right now. So Brittany came yesterday, and our patient census is starting to build up again. We did see 11 patients yesterday and 7 today. We usually see twice that number or 3 times that number, but it's really nice because we're able to walk through our charting and discuss the disease and the presentation and the exam at a nice slow pace and focused in on that and one-on-one. And she's experienced several telehealth visits, and I've been able to turn the visit over to her, and I just sit in the chair next to her, and the parents know that I'm in the room, and I think it's been great. Mm-hmm. Yeah, we'll have some more students coming at the end of the month.
Mm-hmm.
We do have a small office, but because the census is low, we've been able to spread out our staff working hours so that there's not a lot of people in the office. And because the census is low, we also spread out our appointments. So we rarely have more than 3 or 4 people in the office at the same time. Everyone wears masks. We keep our door locked. And people have to call us before they come in. We screen their temperature at the door. And we don't accept any sick patients in person. We do all of this by telehealth.
Awesome. I'm happy to see students back. It was concerning for us at the AHEC when students had to go home so abruptly. And I'm glad to see they're getting an opportunity to live and experience and learn at the same time. What do you think, how best, so related to the influence on education, what are some of the best lessons learned from COVID to improve healthcare education?
Well, we have always depended a lot on book learning and memorization, and the hands-on has been usually less than 50% of our students' experience. So I think these students, and this goes for everyone from kindergarten to medical school that have had to miss some rotations, are doing more book learning. They'll catch up though, and I believe that at all ages, that what you learn in school is you're learning how to learn. Mm-hmm. So if you eventually they'll get the exposure, and I don't think in the long run we're really going to see that it was much of a dent in the progression of these young people's lives and education. And I think the other message is that how badly they're needed, how much we all depend on our healthcare providers at all levels, and that it's a pretty good job security, hopefully, if the hospitals don't continue closing and laying off their employees, so that it's a good career, and we can adjust. We're used to adjusting.
What have you learned about yourself? What scares you?
I'm pretty peaceful right now. I can't say that I've had a lot more free time, but I'll tell you, I always went to mass every day, and church and Bible study, and that all went away. So I have my own worship time, and I have Zoom worship meetings with my Episcopal church. And I have a lot more time filled with reading and studying about COVID, just because I get so many questions, and I feel like I'm a spokesperson in the community. And we have our blog, highaltitudehealth.com, and we publish something every week on COVID at high altitude. And we talk to experts, and we record videos like this, and we put them on our Facebook site. And almost once a week, the local newspaper will include me in an interview on some topic. So it's been pretty intense as far as that is concerned. That's kind of filled up my free time.
Where are you getting your information, or where would you recommend people get information about COVID if they're wanting to do some reading up on their own? Up to their healthcare provider?
No. I think your healthcare provider has a lot to do. And the problem is that the healthcare providers we are being bombarded with new information every day, like the antibody testing. Take that as an example. It's out there in the media, in the news, in social media that, get your, antibody testing. This is the answer. But it's not the answer. Yeah, it's not. It does. What does it tell us? Even the COVID test itself, what does it tell us? It only tells us the people who were tested. And we have so many, what I believe are false negatives. We know that that's at least 30%.
Really?
And we don't know, how many people are tested. Only a small microcosm of the population are tested. So there is so much confusion out there as far as what is really going on. And I think it's at all levels, from the president right down to your local doctor, as to what is really going on. And a day doesn't go by when a parent doesn't ask me something. And when I give him my best information, they come back with something new that they've heard. Mm-hmm. For example, yesterday we saw a 4-year-old who had a red swollen toe. And after we went through our telehealth history exam, symptoms, how is he feeling and everything, at the end, the father, that dumps this bomb on us. Well, could it be COVID toes? Mm-hmm. And that happens every day. Every day, a patient or someone in the community will tell me something that, in spite of my super efforts to read medical literature, to read the Atlantic, the New York, the newspaper, all the things that come across my email from medical sites, there's a lot of confusion there. It's very hard to know the answer to all these questions. Where did we start at here? Or where do I get my information? Well, I'll tell you one thing. I do read the Journal of High Altitude Medicine and Biology, and the editor, Eric Swenson, is a friend of mine from work we've done together, and Peter Hackett at the Hypoxia Institute in Telluride. We've done some work together, go to conferences. So when I have a specific question that overlaps the symptoms of COVID and altitude, I do have access to them. Okay. And Eric was made himself available to our local newspaper for an extensive interview about the lung disease and HAPE and COVID. And so resources, personal resources, professional resources, and just the media out there. There was an excellent article this morning that came into, I think it was from the New York paper, which I just recently got on email, and it came out of the University of Minnesota Department of Epidemiology. Mm-hmm. And they were talking about the 3 possible future waves of COVID and how they could present. And I thought that was fascinating, and I shared that with my family members, because even though we don't know which wave will come, but I thought that was a very professional organization. In fact, they're working with me on some of my high altitude research. And so I thought these are reputable people, and they're not telling you this is the answer. They're just saying this is what could possibly our future look like over the next 2 years.
Mm-hmm. What is your hope for a vaccine?
Well, 18 months, even if they make one in 9 months and they think it's safe, then they have to manufacture it, then they have to distribute it. So 18 months is the big number that's been coming out at me and the things I've read lately.
Yeah, that seems still awfully fast.
It's sure going to change people's attitude towards vaccination, isn't it?
I sure hope so.
That's another good thing.
I sure hope so. Boy, if we don't mess, it's gotta work, and or just be the absolute worst.
I'll tell you a cute thing that I heard this afternoon. I also listen to a lot of podcasts, but this one young woman who has a very lively podcast had invited people to say, how is your life going to change? What are you going to do differently after this is over or starting now? And one of the things they said is, we're not going to blow out the candles on the birthday cake. He said, cut off the piece for the celebrant and put the candles all on that piece so they can blow on their piece.
Yes, they don't need to blow all
That made a lot of sense.
That's funny. Yeah, that does. I hadn't heard that one, but I've heard a lot of people saying they won't be shaking hands for a while.
Yes, that makes sense too.
How has this impacted your family?
Well, I have, my parents are 92 and they live in a retirement community in Highlands Ranch in Denver. And luckily, my sister just retired from the State Department and came home from her post in Papua New Guinea, where she was the ambassador in Port Moresby, and bought a house in Centennial. So she and her husband are 10 minutes from my parents.
Nice.
She is directing the International Studies Department at CU Denver. And her first job was to bring back all the students who were studying abroad.
Yeah.
But she is able to work from home, so they have a very safe environment. And my parents, of course, are not allowed to have any visitors, but they can go out. So she will pick them up once a week and take them to her house. So that part of my family, they keep, telling us, why don't you come down for Easter dinner? And I'm like, no, I don't think the people from Summit County should be there. And I have a sister in Glenwood and a brother in Edwards, where we are going to have a scavenger hunt on Zoom tomorrow night. We have had a wine tasting with relatives between Washington, D.C. and Sonoma. And my daughter, who lives in Broomfield, she's moved up to Fort Collins. She regularly conducts a Zumba class with me in the evening in our house.
Nice.
On Zoom. A Zoom Zumba.
Zoom Zumba. That sounds great.
Yeah, and I'm luckily, I have a son and a daughter-in-law with me at home. And we have a student that's staying in our home. So we are always doing great things, gardening and dancing and listening to music and cooking. A lot of gourmet cooking going on at my house.
Yeah. Is there anything else you want to talk about?
Oh, I'm surprised I had this much to say.
Well, I sure appreciate your time and talking with us and sharing with us about what's going on in your community.